who do not even have to find a job.
And 1 in 5 adults, 1 in 5, that's between the ages of 18 and 64, are not even looking for work. But does the benefits system risk moving people away from finding work?
Yes, curious. Well, let's pose that question to Deven Ghelani, Director and Founder of Policy in Practice, which helps families get benefits they can qualify for. Thank you very much for joining us, Deven. Is the benefit system somehow encouraging people to move away from finding work? What's going on here? It seems to be a shocking number of people who are on out-of-work benefits of one type or another.
Yeah, so we looked at it and the number of people without work requirements has been going up, but we wanted to try and understand why. So what we looked at was some of the numbers before the pandemic from 2015 all the way through to 2023. And what you saw is that before the pandemic, reforms such as universal credit meant that more people were expected to look for work. So you saw an increase in the number of people who are out of work facing work requirements. And then what you saw post-pandemic was almost a reversal of that trend of seeing more people who were out of work and not expected to look for work because they were too sick, too ill, and there'd been a growing number of people in what's called the support group or the limited capability for work-related activity. So we want to try and understand why that was. And I think there are 3 main drivers that you can see. So firstly, before the pandemic, you did see this tightening of expectations for people to look for work, and you did see some of that working initially. But then what you saw were reforms in 2017, so changing how disability benefits worked, which made it harder for people who were maybe just a little bit ill to get any support at all. So they would be able to get some support, maybe £30 a week or so, and they might be on that for a bit and then be able to get back into work. But that was eliminated as part of austerity, which meant that those people didn't have that support. We think a lot of those people got sicker. A lot of people then only had the option to apply for the more stringent but maybe heavier long-term out-of-work group. So we think some of those people that would have gone back into work or maybe been on short-term sick and gone back into work have now moved on to long-term sick. So I think that's one thing.
That's a really interesting point, Deven, because it might mean that these people aren't necessarily unfit to work, but in order to claim some money, they might have to say that they are. The system from 2017 onwards is almost incentivising people to say, no, I'm completely unfit to work, whereas before there was sort of a middle option for people who perhaps weren't completely fighting fit, but weren't unable to work entirely. It seems like we've moved to an all-or-nothing system, perhaps.
I think we have moved more to an all-or-nothing system, that's true, and I don't think that's been very good. I mean, that was one of the reasons. I think the other big reason is that we had a pandemic and we're still recovering. So we speak to a lot of Policy in Practice, speaks to lots of organisations on the front line. We support them, we work with them. One of the things we're hearing is a lot of the people that are out of work would like to get back into work but aren't getting the health support they need early enough. So as well as this change to benefits, you've also got a health system that's struggling to get people healthy again. So I think what you saw is some people who perhaps maybe didn't apply for that long-term out of work group initially, but they got sicker. So if they do get sicker, then they're going to apply and they're going to be successful applying, and they're not going to be expected to look for work. So that's I think a second reason is the health system hasn't been able to keep up with or get people back on their feet quickly enough.
With demand not being able to keep up with the demand on the service. But Deven, how common and widespread is abuse of the benefits system? Of course, we hear stories of particular cases of people taking the mick. How prevalent do you believe that is?
So I think it's overblown would be my summary. Considerably overblown. I mean, I think when you look at fraud and error, you always combine those two, and error is always considerably greater than fraud in the benefit system. At the same time, whenever there is someone that has been taking advantage of the benefit system, they're the ones that perhaps are more likely to end up on your show or on the front pages of the newspaper. And that's been more of a trend over the last, as we've seen austerity kind of come through to say, actually, the benefit system too generous.
Although if you're only a little bit ill and you're on long-term sickness benefits, that is fraudulent, is it not?
Well, if they are a little bit ill, they probably wouldn't be on long-term sick. So I think there are people who were perhaps a little bit ill and got sicker. because they weren't able to get the health support that they needed. So I think a lot of this is about the support around it. And the third reason that we identified in our report, it's worth mentioning, is if those people that are on long-term sick were to take steps to try and get back into work, and then they were reassessed, they then face what is kind of a much more punitive back to work regime with the risk of sanctions, with the risk of it's seen as something to avoid. And I think that there are some, I'd say this under Rishi Sunak and Jeremy Hunt, you've seen much more of a supportive approach. Maybe the rhetoric hasn't changed, but actually the policies are a little bit more supportive. So the government's back to work plan is better than other plans.
Perhaps
it's much
more of a taper than this feast and famine system that came in previously. But Deven Ghelani, I'm afraid we have run out of time there. I really appreciate your thoughts on this issue.